we're ready. We're back. I went and got my cup of tea. Thank you for your patience. Needed this to keep going, and I hope everybody else had a chance to stretch and get a beverage or something to eat and are ready to hear Alana's story because it's very interesting and unusual. Alana, I think you had a bit of a unique experience with your diagnosis and following treatment. So we're excited to hear about it. So I'll let you introduce yourself and share as much as you want to share or not share. That's okay. We say that at coffee, as Alana is also one of our coffee chat visitors. And, we always say when we start a coffee chat, it's a safe space. Your story stays here. But if you don't want to share, that's okay. And if you just want to listen, that's okay too, because not everybody's ready to share their story. So I truly appreciate what you're going to share. So I think you had some slides, Alana.
I do. I don't know where they are.
I think they will be coming now.
Okay.
I think hopefully all of your slides worked. Okay.
I think they got it figured out there.
Oh, perfect. I didn't. So I was leaving it to the experts. So Alana, take it away and I'll join you for questions after.
Okay. Well, I really enjoyed listening to Carolyn actually just previous to this. Sharing so many things she had to say really resonated with experiences I've had and what my last year has looked like with this cancer diagnosis. The living rural and travel accommodations, the services that the BC Cancer Agency, which is the province that I'm located in, has provided me with, have made quite a difference in overall stress levels and not having so much of that financial stress going through this. And then she had so much to say just about survivorship and having to deal with so much of the kind of PTSD that follows after a diagnosis. A lot of what I'm sharing kind of is today is focused back on what I went through a year ago. And now being a year later, so much has changed. So much has happened in the last year. It's cancers. At the beginning of the diagnosis, I hated the word journey. I'm like, a journey is something I choose to go on, kind of like a holiday. And this is not a journey. This has been a ride. Anyways, back when I was diagnosed in September, I was 43 years old, and that was 2024. My only symptom was, in hindsight, looking back, I can actually see that I fell under, an umbrella of a lot of the symptoms that could be attributed to so many different things. And now looking back, I had so many of them. But of course, you never, directly take that diagnosis just from, back pain or a little bit of sweaty nights when you're a 40-year-old woman, right? So when I was diagnosed, like I said, I had some urine or some blood in my urine, and that was pretty much my only symptom that was observable. I am a nurse in a rural hospital in British Columbia, and I actually discovered it at work, and I still attribute to my career to being a little bit of why I was diagnosed, luckily before it became metastatic, but very borderline, sitting on that teeter-totter. At the time of my diagnosis, my tumor was, I think, about 9 centimeters inside my kidney. It had gone into my renal sinus and up my IVC, another 9 centimeters. Locally here, and this is where, what Carolyn had said about, the assistance with travel and everything else. I'm 4 hours from our big city provincial university hospital. And because of the complexity of my disease, all my treatment did need to happen from there. They were not able to do it in our rural areas, and even in our regional hospital here. So in the last year, I have had a total of 16 trips at minimum down to Vancouver, Vancouver General Hospital, where my surgery was, where all of my oncology care has been as well, and follow up and treatment over the last year. So I can share a little bit more about that later. But just in reflection to the travel assistance and accommodation services that the BC Cancer Agency has provided, my personal expenses, without any financial support from the two resources that I was able to get that from, totaled over $21,000. And that's without any loss of income. That's without any caregiver loss of income. And that's without any like caregiver meals as well. So, she hit the nail right on the head by being around that $25,000 mark. So the financial strain on families, right from the get-go is really significant and can really hurt people, especially those that kind of start out in a lower kind of economic stance. So when I was diagnosed, from the time I was diagnosed to my surgery was a 5-week period. And it was absolutely the worst time of my life. I had, a lot of pain at that time from a unrelated UTI, but I guess probably because of the cancer, the pain was quite a lot more significant. And when you become symptomatic with a disease, that's where it really rises that level of fear, because it's just a reminder that disease is there, that cancer is there. And so moving forward, right from diagnosis to today, over a year later, when I have symptoms of anything, it very much takes me back to that time period, and that fear and all that PTSD kind of comes back for me, and flashbacks. So this is something that I still am dealing with, is all of this, mental health aspect of survivorship, like Carolyn was talking about there. Even just yesterday, I was in Emerge for the day. I've had this cough for a couple of weeks. You can hear it in my voice. I'm also coming off of a high-dose prednisone right now for the last 2 months. And so I've been very symptomatic of side effects. Yesterday, taking me into Emerge, and, just having a doctor tell me, you just have a cold right now. But you may as well have told me that, like, you're going to live and everything's going to be okay. Because, the relief that I had just from her letting me know that, like, you just have a cold, it hits 10 times harder than ever being told that I just had a cold in my past. It definitely just, that ball rolling of all of that fear that you have of reoccurrence. So I was diagnosed with stage 3, grade 4. I have rhabdoid features. So of course, such a high risk of reoccurrence has every symptom always, popping that little fear bubble, up above my head. And luckily, I have the nursing background to also be able to put the rationale with that. And I can usually talk myself down out of that. But, it's a really difficult thing to do. So I do have a good understanding of how the healthcare system works. At that time a year ago, understanding the delays that were and all the work that was happening for me behind the scenes in trying to arrange, the higher level of the care that was required for me preoperatively, in terms of having specialists perform my surgery. I needed a hepatic surgeon, And I also had a renal cancer urology specialist that did my surgery. So I was able to be patient during this time, understanding that, even though, the communication wasn't, daily like I wish it was at that time, just for my own reassurance, I knew things were happening behind the background, in the background for myself. Um, at that time, my mind was running. The anxiety was too much to cope with. I was able to kind of gather my thoughts enough to realize that I needed really early intervention, mental health support. I needed more than, I knew how to give myself at that time. I found a lot of support in online groups. They answered a lot of questions for me. I was able to find a lot of peace, and they were really, really therapeutic for me. I've continued working with these groups over the last year. They continue to be therapeutic for me. And also in the times that, I have a lot of peace in my own life, I'm able to offer support to other people. So it's a real give and take with these support groups that are online. And so those have just been a really wonderful source of kind of, supporting me in mental health. Before my surgery, I also really felt this loss of control. 43 years old, relatively healthy otherwise, working in nursing, loving my career. And all of a sudden, something has been thrown my direction that's completely out of my control. I'm fearing for my life at that point, and I didn't know what to do with it. And I had to really kind of gather my thoughts and think, from a nursing perspective, which allowed me to kind of keep my head on straight during that difficult time. And so I started to kind of create a little bit of a plan for myself. I knew I was going to have a really significant surgery. My surgery, in the end, it was an open radical nephrectomy. It was a rooftop incision. I ended up with 44 staples because they had to kind of stabilize my liver as well. It was quite a difficult recovery. It really was. Only in the last couple of months have I actually recovered, or am still recovering, but feel that I've recovered from the actual surgery itself. So it was definitely a 6 to 8 month process that I went through there. Knowing that so much had kind of fallen out of my control there. Sorry, I'm just trying to see how I can advance this slide. Do I know how to do this? So at that point, before my surgery, I realized I had to kind of navigate the journey of recovery, physically and mentally. And, because of what I did, you can advance the slide. Because of what I did in nursing, I was able to kind of come up with a care plan for myself. I realized that I had to. You can advance this slide too, please. So this is actually a picture before I went into my surgery. Just kind of talking about the gap in the perioperative care that I experienced. So before my surgery, sorry, I'm kind of bouncing around a little bit here. Before my surgery, everyone was working for me behind the scenes, and I knew this, and that was amazing. But their focus at that time was to save my life. Their focus wasn't to take care of my mental health. I didn't have, and that's where, like I said, those care groups came in. But I felt left out of this plan. There's nothing that I can do surgically to save myself or help myself. That was, my team's job. But what I had to do was find a way that I could fit into being a really important piece of this puzzle, because I was just felt I felt like I was being left in the background. And, so just like my job in a hospital and kind of like care planning my patients' needs, I kind of decided to come up with a care plan for my own needs and what I could do to kind of take a little bit of control of my own story. So I was able to, gather resources and, information that I knew from my own job about taking care of people, preoperatively and postoperatively, and recognize the things that were within my control and the things I could do. And so what I started to do was put a plan together for after my surgery so that when I woke up from surgery, I had a role in my own healing. It kind of, set me up with the motivation and the planning to know what I needed to do to get better as fast as I could to prevent any postoperative complications. So that was kind of where this idea came from, was trying to find a way for patients to feel like they played a role in their own care and were able to play a role in their healing process. So I saw this gap because they were, everybody else was just busy trying to, come up with a plan to surgically and medically save me. But, um, with all of the trauma that was going on, I wasn't hearing a lot about what was happening around me. So even if maybe suggestions were being offered to me, um, there's so much that you don't retain in that time period. Um, so can I advance this again? So the goal of this was to kind of empower myself, to get back a little bit of control for myself. And so, with what I've spoken about here, some of the things that can be implemented a little bit earlier than later is, some crisis support referrals right at diagnosis. The thing is that, when we're diagnosed, we're so consumed with, our disease and what's going to happen and our families. And, there's not a lot of immediate intervention in caring for our own mental health. And so, that allows for all of the anxiety and everything to really build for ourselves. We also feel a real stigma around it. I should be coping with this better. Why am I having this level of anxiety? And it just impacts your daily living immediately on diagnosis. Cancer is such a scary word that we hear, and it comes with so much uncertainty, right? The other thing that I focused on was setting goals perioperatively, meaning before and after my surgery. So I'll get into that a little bit in a minute. And then again, reaching out to some of those peer support resources earlier than later. And you find a lot of care and love through those groups from other people that actually go through it. I'll move the next slide forward. So having physicians maybe approaching care planning with their patients a little bit earlier on in a diagnosis can, like I said, set our patients up for more success and empowerment in their own healing postoperatively, giving them an idea of what they're going to be looking at in the future. I had to create this role for myself. And with my experience, I was able to kind of start seeing a clear pathway for my own role in my recovery. So one of the suggestions that, I've had that I've passed on is to really include patients in the care planning process for their post-op care earlier on so that they come out more motivated. Okay, so this is kind of a little bit, I'm just gonna. So I focused on basically post-operative. We know that these are kind of the most high risk post-operative complications, and they're really can be resolved by a few techniques and that intertwine all of them. So just by, having these simple practices involved in your care plan for yourself can really reduce kind of the overall things that are within your own control. So as a patient, we don't have control for, when Dr. Or when Caden Jobin, the med student there, when he was talking, he focused a lot on the risks of the surgery, right? But when we're looking at post-operative complications, we're really looking at things that the patient can control. And so, those things really are, your mobility. Like as a patient, you have the ability to be able to get up and move yourself more. If you're not able to get out of bed, you have the ability to move your legs in bed, to, ride a bike with your legs when you're laying in bed, to be wiggling your feet. And, you have the ability to be doing deep breathing, using an incentive spirometer really, really early on can prevent those risks of blood clots and pneumonia, getting your lungs moving. With that deep breathing, stops all of your secretions from kind of settling. And, it's also prevention of blood clots as well. Is, the more you want your lungs working really hard afterwards. Keeping hydrated also thins all your secretions in your chest. It also can, keeps all of your bowels lubricated. Then you look at the mobilization here, how it helps prevent the pneumonia by, having your lungs expanding more, up with mobility. The hydration, the mobilization keeps the motility going in your bowels as well. Having, the nutritional support of, the right types of foods, and also, proteins to help with your wound healing. So you can I kind of compartmentalized here and kind of showed how, just having 3 or 4 things that are within a patient's control kind of reduce, the risk of the most common post-operative complications. Also, being in charge of managing your own pain. So without having adequate pain management, your pain does become a barrier to being able to carry out this care plan of being able to mobilize, of being awake and alert enough to know, that you need to, breathe deep, that you need to be drinking and eating and doing all of these things in order to prevent all of these other complications. But going into the surgery, with cues and ideas of how I could do these things is really what sparked me when I woke up from surgery. And so when I very first woke up, it was the first thing I was thinking of, was, okay, time to put your plan in place. And funny enough, it wasn't, as groggy as I was, because I had this plan set out in my head about the things that I could do to get better. I was mentally prepared to get up and start walking right away. I ended up in the PAR for probably 12 hours due to complications. And, as soon as I had gotten transferred back into a room, I wanted to be moving. I was like, get me a drink, please. I probably was one of those, nurse patients that you don't ever want to have, because I just started like naming off all of these things I wanted. I wanted my incentive spirometer. I wanted stockings on. I wanted a walker. I wanted to get up and walk, even though, my blood pressure was in my boots and everything else. I had this plan in my head, and that plan really drove me to do all of these things really, really early on. And so I really credit a lot of these things for healing me in the hospital a lot sooner than I think I would have been. It still was a very long recovery for me. It was really grueling. But when you understand how these small actions make really big impact, it makes a huge difference, and also drives your motivation to do it. I used I used, certain cues throughout the day that were my cues in terms of when I was going to implement these things. So it was like every time a meal tray came, that was you're going to, sit up at the bedside. You're going to, whether you can eat or not, which I didn't for quite a while, you're going to use that. You're going to, take a few bites, you're going to force it into you. And then you're going to use until the next meal to drink your boost shake that they give you. After your meal, you're going to get up and go for a walk. So, all of these, routine, regular kind of hospital things that they do, such as bringing your meals or your MedAdmin, things that are scheduled. I took those and I used them as my cue to, okay, it's time to get your incentive spirometer. It's time to do your deep breathing. And so I had this plan, and because of that, even through the confusion and the grogginess and everything else of the heavy medications that you're on post-operatively, and then I was on quite a bit. Because I had that plan in place beforehand. I had those cues that was like, do this, do this, do this. Without going into it, without that, I wouldn't have had this plan. I wouldn't have done the things that I did, and I wouldn't have remembered to do them. Um, okay, let's move forward here. So again, going back to mental health, I did speak a little bit about this. Already. So these are my emotional support gingerbread men that all of my family held on to while I was in surgery there. I'll move forward to the next slide. My oncologist, wonderful guy. So again, how can our doctors help us? And the thing is that as a patient, you can't be afraid to ask. You have to advocate for yourself. A doctor can only do for you what he knows you need, and they can't read your mind. So you have to really be an active participant in advocating for your own needs and what you need. And this is really hard for people to do. We often, fear offending people, fear seeming too needy. There's a lot of reassurance seeking behaviors that come, and I'm not saying that as a negative thing. It's very real, and it's very needed in order to support your own mental health going through a disease. But it's our doctors that are ultimately going to be able to provide that reassurance to us. And so you can't feel bad, if you need that reassurance from a physician either. And there's, a lot of stigma. I don't know, maybe it's because I'm a nurse that, I put a lot of weight on myself with the mental health struggle of the disease, in feeling that maybe I shouldn't be suffering as much as I am. But the reality is I am. And that's okay with me. I can completely accept it. And I know that I have this struggle and I own it and I allow myself to feel the feelings that I have. But our doctors can really choose to empower us, or they can, treat us medically. And, the really great doctors out there are the ones that encompass that, like, kind of, holistic approach of body and mind. And so asking for what you need is something that everyone should feel comfortable with doing. Upon getting a diagnosis, another thing that I really recommend whenever I do talk to any doctors or specialists or anyone is when you are the doctor that's delivering a diagnosis, you're delivering it, and the person that's receiving it is in so much shock. And we're not going to have questions in that moment, not very many anyways. But within the next 24 hours, it's going to be a really terrible period, and we're going to be coming up with a lot of questions. Scheduling a appointment with your patient 24 hours after you deliver that diagnosis is a really, really beneficial thing for your patient. And I really highly recommend that to all of the specialists that I am able to reach out to. It's kind of the number one thing that I push. But as a patient, even going through your cancer, your oncology treatment, anything else, is ask for those follow-up phone calls. There's a lot of times where you have decisions to make and you can't make it in that phone call, but it's really hard to get a follow-up, within a small amount of time that decision needs to be made, and you're going to have questions. So, asking after you are in a situation that you're offered suggestions for to be able to process it and then come back with those few questions, is something you usually need to ask for. So it is something that I do. Can I have an appointment in 2 days to ask all the questions that I'm going to come up with in the next 2 days? And so I take the opportunity of my phone calls with my oncologist to reschedule another appointment for 2 days' time. And you can't feel bad about doing that. You just have to stick up for yourself. So involving yourself in your care plan and creating a care plan before you go into surgery is really awesome to set yourself up for the best success that you can. When we take on these roles, we're empowering ourselves. I went from being completely helpless to very focused and goal motivated because I was going into it with a plan. I was going into it with a clear understanding of what my role was. That allowed me to put this game plan into action and, achieve my goals early. My post-op care plan reframed what could have been like such a more delayed recovery, both mentally and physically for me. So, if we were able to, create care plans and teach our patients before going in, what they can do to help themselves, we're empowering them and giving them a role so that while everything's happening in the background for us, we can actually be in the forefront creating our own plan at home. And this gives us a task as well, right? Asking, from a doctor's perspective, asking our patients, giving them responsibilities, asking them, to complete a certain task, whatever it is, whether it's redundant or not, it empowers that patient to feel like I have a role in this. And so, by giving tasks to patients, or early on, is really encouraging for a patient and gives them something to be working on in the background. It's, Dr. Is it Tangway that we were speaking to earlier? He was talking about the ARIS kind of surgical booklet that he came up or provides his patients for kind of the perioperative planning. I don't think I saw this book. And if I did, it was given to me in a time that my mental state was not able to receive it. So, being aware of the capacity of the information that a person is able to retain during this really traumatic period of a diagnosis, and that, I call it purgatory, that state of unknown being, between your diagnosis and your surgery or your pathology, whatever kind of chapter that is the worst time period for a cancer patient. Our ability to retain anything given to us in that period of time, for me, was non-existent. I had social work come and see me while I was in the hospital. I still have no idea what they talked to me about. They left a couple pieces of paper, but whatever I had asked for at the time, I don't remember. What they had delivered to me, I don't remember. Having these resources available is wonderful, but if we're not able to retain any of that information, it's not going to help us. Making sure that, they, communicate with, your caregiver while in the hospital to be there at the same time, that, arranging these appointment times so that you have someone there that can retain this information for you, is quite helpful. So there was a lot of gaps in care that I experienced while I was in the hospital. Whether they were actually gaps in care or whether, they were gaps in my ability to recall or retain information due to the trauma that you go through during that time, I still don't know. But what I can recall is the plan I had in place. And so that's kind of where I've taken, the focus of a lot of how I try to help other people in some of these peer support groups that I'm in is, creating this perioperative plan for themselves, helping them to come up with the best care plan for themselves based on, their diagnosis, where they're at, meeting them with the amount of knowledge that they want to receive, and kind of being there post-operatively for them if I can, if they reach out, to be able to support them through what was, the worst time in my life. You have to be an active participant in your own healing, and being empowered through preparedness, through knowledge, through advocating in yourself, and having the ability and the strength and support from others in knowing that advocating for yourself is okay and expected and the best thing for you. And then having these personal connections with other people that are going through the exact same things that you've been through, are really what carried me through. So let's go to the next slide. So again, this is basically what I just covered. This was a photo of, I believe, the next day after my surgery, sitting up, wiggling my legs. At that point, really barely able to walk, but forcing myself to. And can I go to the next page? Oh, this picture. I have a family picture of myself going into the hospital with all of my family standing here, and I did not believe that I would survive that surgery. This is coming out, standing in the same spot afterwards. And, I had my husband take this picture, and then after he took it, I broke down. And so this picture actually just, it's to me still signifies the strength I felt, and the beginning of a healing plan, and a really a new life. But going back to the basics of perioperative planning, caring for yourself, creating a care plan, connection with others, and collaborating with others that have been through this, allows you to be able to heal. And it becomes this word journey that I wasn't fond of, but it sure is a ride. So I'll tell you a little bit about just kind of my last year now and what I've been through. I was offered, upon my referral to oncology, I was offered a few choices. I was offered to watch and wait. I was offered Keytruda as adjuvant therapy, as I did not have any evidence of any metastatic disease at that time. I was also offered the opportunity to participate in a clinical trial. This clinical trial was sponsored by Merck, and it is a mRNA vaccine that was created from, I believe, like 34 biomarkers of my own tumor. So I opted for the clinical trial. Someone, a support person that I had met online very early on in my diagnosis, had said to me, and this stuck out to me, if you're ever offered a clinical trial, take it. Now, I didn't know why, but that stuck out to me. So when I was offered this clinical trial, I was very keen to learn more about it. I did end up opting for the clinical trial after everything. And I know from the side effects that I had from, this was a mRNA cancer vaccine made with the biomarkers of my own tumor. I know without a doubt in my heart, although clinically I don't know, that I absolutely received the vaccine. I experienced a lot of side effects from this vaccine. I seem to be very hypersensitive to the most unusual of side effects. But I do in my heart feel that I received this vaccine. I received 7 doses of it. I was required to travel to Vancouver from a rural community 4 hours east of Vancouver every 3 weeks. And I continued to through 4 seasons, through mountain passes, This is where all of those financial expenses come from. The clinical trial. Now, I was able to access the BC Cancer Agency for some funding. I accessed this grant for the travel services for fuel expenses, which was so appreciated. Um, you never know where the money and the donations go to until you're a cancer patient, and then you really see the work that this agency does and how spectacular they are. Um, Being a part of a clinical trial, I was told through the support groups again, and these are all the wonderful little tools that speaking to people that have been through this before offer you, is to request financial support for your travel and accommodation and food expenses. So traveling 4 hours every 3 weeks, and I was required to be down there for two days each time. I applied for financial support from Merck and was granted it. And so the over $21,000 in expenses that I've had since the beginning of this diagnosis has been almost fully reimbursed by Merck. And in this clinical trial, I can't speak to what my care would have looked like other than I do share an oncologist who also is my study doctor. The care that the one-to-one care that you receive in a clinical trial is unreal. The support that I've had, and I just have a spectacular team as well. But the emotional support, the mental health support I've had through them is one thing. They've been an incredibly compassionate team. But the one-to-one patient care support that I have received as well. I have a trial nurse who works directly with me. I'm able to communicate with her at any time that I need. She is prompt in getting back to me. The monitoring has been superb. I feel so safe and taken care of in their arms. And I say in their arms because I feel embraced by my care team. And then aside from that financial support, in order for me to go down to the coast for my treatment, would not have been nearly what it is without the support of being in a clinical trial. Although the cancer agency provides accommodation services if needed, I have left those to people that did not have the opportunity to access the support from the pharmaceutical company. And while moving forward, I will likely need to, but hopefully not need to, utilize the BC Cancer Lodge too much. So these side effects that I did experience, I still, they were rare and unusual, and I was enrolled, and I still am enrolled and being monitored, but I was an active participant in receiving the Keytruda and the vaccine for about 8 months, 7 months. And before I was pleasantly discharged due to side effects. And you'll see I'm a little bit puffier than in these pictures. I've been on some pretty high dose steroids for the last 2 months, and I'm just slowly coming off of these. I have not had what they can call a reoccurrence yet. I feel personally, I feel very strongly that that this vaccine is effective for me. I've had some real suspicious red flags that, in a very suspicious way, have begun to heal themselves, and in a way that doesn't happen from immunotherapy. So I've been a little bit interesting for my oncology team. They don't quite know what to do with me. Lots of collaboration and lots of support. But I can still say that I'm reoccurrence free, although the fear lives strong in me. I do the best I can on a daily basis to work through this. On a daily basis, I do well. But anytime you have a sore throat or a cough or an itch, you go right back to that, doom thinking of worst case scenario. Um, and I think that this is really normal. So I embrace it, but I work hard at it. I'm not sure. I think that's pretty much it for kind of what I can think of to share about my own journey a little bit. Um, yeah, I can't hear you there, Christine. Did you say
Oh,
something?
no, I was waiting, just waiting for you to finish. My
Yeah, I
goodness,
think I think that's pretty much kind of what I had to share with you guys. Um,
that's
because I'm
fantastic.
sick right now. I'm all like T3 groggy, trying to get rid of this
Yeah,
cough, and so my thoughts are a little bit foggy with all the treatment I've had. I'm definitely not as clear-minded as I have been. But so a
well,
little bit off in left field here and there when I'm talking. I'm sorry about
no, you
the
did
branches
great.
I kind of took off on, but my focus is definitely affected from all the medication I've received in the last year.
Alana, no apologies needed. We all have a concept of what you might have gone through, and my God, you have gone through it. And I cannot thank you enough how impactful your story has been, and even just the hearts and comments that have come through. You have really reached, I think, the hearts and minds of the patients that are here with us today. And certainly, we have talked a little bit about having your perioperative plan included on our website, because just in the comments, it shows how valuable this information is. And we thank you for being a nurse who did this for people before you. And now as a patient, you've created this for other patients. I can't thank you enough for sharing your story and sharing this learning tool for us. And there's points in there. First, I want to ask you, what is a spirometer?
An incentive spirometer is a tool that can be provided by any hospital.
Mm-hmm.
It is basically a little. They make deep breathing into a game, and so it has three balls. It's got a tube coming off of it, and it encourages you to lift all three of the balls, to take the deepest breath in that you possibly can, and to hold them up as long as possible. So, anytime anybody has pneumonia or is post-operative, it gets those lungs moving, keeps them nice and open,
Mm-hmm.
hopefully, preventing, and providing the exercise that your lungs need to prevent any mucus from settling and turning
Mm-hmm.
into pneumonia. And so, even if you're not in a position post-operatively that you can get up and you can walk around to expand those lungs,
Mm-hmm.
having that there, and especially, like I said, always try to find cues
Mm-hmm.
that will remind you. When I have patients, I tell them, how about if you're watching a TV, you do,
Mm-hmm.
a TV program, you
Mm-hmm.
do 2 breaths with an incentive
Mm-hmm.
spirometer every commercial break.
Oh,
So,
okay.
finding little tiny isms to
Right.
remind yourself to do each task is a really, really beneficial thing to help cue people, or to cue family members if a patient has any other, any impairment of the mind where they're
Yep.
not
Yep.
able to remember to do this on their own. So
Right.
it's a breathing tool. It's a technique. Um,
Okay.
uh,
And it will benefit you going into surgery and certainly coming out of surgery. So this is something that you should try to do prior to your surgery date.
well, not necessarily. It's not really something that we offer like preoperatively. Um,
Okay.
yeah, it's, I mean, we breathe normally. The thing is when we go into surgeries, we go from, being these mobile people moving around our home, or the majority of us,
Mm-hmm.
um, to, being sedentary and laying in a bed for a couple
Mhm.
of days,
Yes.
that's when the opportunity for any pneumonias, blood clots really
Mhm.
sets in. And those are, really directly related in some ways to, things that are within our control as patients. And that's where, the mobility is so important. All
Mhm.
of a sudden we're laying there, our lungs aren't expanding the way that they should be.
Mhm.
Our secretions are settling. We're not drinking as much. Now they're becoming thicker. We're not
Mhm.
moving, we're post-operative. So the risk of blood clots is higher. As cancer patients, your risk of blood clots is higher with all the medications you're taking and everything. So, the things that are within your control are the mobility, the hydration, the nutrition for healing, the maintaining skin integrity, and your deep breathing to do the best you can to prevent pneumonias from setting in.
Mhm.
And so, we go from moving around in our daily life to all of a sudden being in bed for a couple of days.
Yes.
And, that is, a prime opportunity for all of these problems to arise. So
Mhm.
preoperatively, no, it's not really required. We're up and walking around, same.
Okay. Okay. Um, there was just so many things. There's a lot of interest on the chat about the vaccine that you did in a clinical trial, and I thank you for speaking about your clinical trials. That's something that we are going to have a webinar on in 2026 because you echoed how important the clinical trials are and the kind of care that you get being on a clinical trial. We always say if you have the opportunity, you should certainly consider it. It's not for
Yeah.
everybody, but you should certainly consider it, not only because of what you might find out or do or whatever, but also for the extra care that you get. And it sounds like you did well with your.
Yeah, I do have a phenomenal team. I can't speak higher of them. But the one thing that, I've learned,
Mhm.
and I'll start by saying I would not change the decision that I made as far as my treatment plan.
Mhm.
Um, Side effects, when I made my decision, so, I naively disregarded the consideration of side effects,
Mhm.
because at the time, part of my decision was fear driven.
Mhm.
Um, and I think that drives a lot of
Mhm.
decisions. The other thing too is I was, of the opinion that like no the the side effects weren't a consideration at the time. But you got to remember with clinical trials and even with like immunotherapy or anything that immunotherapy is even new, and there is the potential for side effects, although so many people don't have any. And when you're going into a clinical trial, depending on the phase that it's in, side effects can be unknown. And so when you're making those decisions, when you're considering clinical trials, you are making a decision with, a little bit of sorry, my word finding is not
That's
all there all
okay.
the time. Um, you're making a decision in unknown territory,
Yeah.
right?
Yeah.
And so, I made this decision. I had, heard the beginning of a lot of exciting news about this mRNA vaccine, a lot of hope that comes with it.
Mhm.
And of course,
Mhm.
like we all have hope when something new comes out. um, I For me, what I speak of that's unusual in my body that we don't know what's happening is, I had a lytic lesion in my spine show up a few months post-op.
Mhm.
And so, we did with okay, if I wasn't in a clinical trial, we probably would have called it mets and we would have changed course of treatment.
Yes.
Because
Yes.
I was in a clinical trial, we require the clinical trial requires two confirmation scans before
Yeah.
they decide to remove you from the trial. On the second scan, this lytic lesion showed a sclerotic border, which means it's healing. It's healing itself. Immunotherapy isn't known to do that with lytic lesions.
Yeah.
Is the vaccine working? I don't know, but I think that's really exciting, and it's continued to heal since. So,
Perfect. Yeah.
specialists are wondering what's going on.
Yeah.
And that's where that unknown is. But at the same time, I've also had life-threatening side effects that I don't know if it's from the immunotherapy or the vaccine.
Right.
And you just don't know. But like I said, I would do this all over again. I wouldn't have changed my
Hmm.
course of treatment. And I think that the majority of people don't have side effects, and so it shouldn't be something that scares you away. But you have to have the awareness, and
Yeah. Yeah. This has been a recurring theme, like just little points that you have just made. And it goes back to Dr. Simon Tanguay early today. He said, you make your decision and you go with it.
Mhm.
Like you do we try to provide as much information, get as much information as you can from your doctor, try and make that decision. And then once you make your decision, you commit to it and go forward. And, you face your challenges, and you have certainly faced challenges, but so many other patients have as well. And I know that we've talked before that kidney cancer is such a unique disease that, what you went through with your diagnosis and the treatment you received, and another patient would go through exactly the same thing, two possibility of two separate reactions, not alike at all.
Yeah,
So,
and yeah, exactly. And you do make your decision and you don't go back. Making that
yeah,
decision is not easy. That was
no,
another horrible little chapter of my life that
yeah,
I lived in, and then I closed. Once I made my decision, I made it.
yeah,
But making that decision, I probably drove every specialist crazy with the amount of questions I had.
yeah,
And I did so much. I had so much reassurance seeking behavior in that time period. I was looking for the answers I wanted, not the
yeah,
answers that were actually the truth.
exactly.
And
Yeah,
if you
we
weren't
all
telling me
do
what I
that.
wanted to hear, I went to
Yeah,
someone else hoping they would. And eventually I keep getting the same answers from multiple different people.
multiple
I'm
people.
starting to.
I
So,
remember we had a conversation when you were trying to make that decision. So, but I totally understand. And every patient that has major decisions to make, but I hope they learn from you that being your own advocate and making a plan and the cues that you used is really like, when your meal came, that's the time to sit up on the side of the bed and that sort of thing. But you can use that carrying on after when you're in treatment. When you get that cue, then this is the time to do that. So that's a great
yeah.
learning strategy. I'm
Yeah,
going
I
to let
did have.
you. Yeah,
Oh,
go ahead. No,
I
go
was just
ahead.
going to say, I did have quite more of like, a detailed care plan for myself, in
Mm-hmm.
terms of what I did. I didn't get into it too much. I just kind of did an overview of the basics, but it because honestly, my mind is just like this right
Mm-hmm.
now with not feeling very well. But I'm always more than happy to talk to anybody, to help them kind of, create a plan that works for them. You have to tailor it around your own abilities,
Right.
around your pre-operative baseline as well. We have people that are going into these surgeries with dementia, with mobility issues already,
Mm-hmm.
with me, whatever their comorbidities are to begin
Yes.
with,
Yes.
are all contributing factors to what their capacity level is afterwards. And
Right.
so being able to, you you can still tailor this plan, regardless of what your baseline is beforehand. It just needs to be altered a little bit, but there are still things that absolutely everybody, can kind of regain a little bit of a sense of control.
Mm-hmm.
And it's, the the only bit of control I had. And then, continuing through this year,
Mm-hmm.
just being able to kind of like share with others, all of being here today. It's all about patient
Yeah.
empowerment and, attending different conferences and learning. Some of us, that's what gets us through this. So,
No question.
meeting people where they're at and being creative to coming up with
Mm-hmm.
different ideas to work with, their mental health and help them and their own care
Yeah.
plan
And
is
your
very
your
patient
whole
specific.
aspect, yeah, of the mental and emotional side. We've heard that repeatedly today too. So we don't want to disregard that. I'm just going to quickly ask you two quick questions from Russell. Did you find to reduce emotional stress is to share your cancer journey, being transparent with family and supportive friends, and have a personal care plan? Want me to repeat it?
Well, sharing, being transparent with my family and friends. No, I find it much more easier to be transparent with people that have gone through this. I find it very, I find it almost triggering a little bit
Yeah.
to be really transparent with my family and friends. I prefer not to discuss a lot with them. With
Yep.
them, I just want to be me. I don't want to be, the questions of how are you feeling is a very loaded question now.
Yes, it is.
And
Yes.
I just want to be Alana to
Yeah.
my family. I, if I have something to share with them, I will share it,
Mm-hmm.
and I'll share the amount that I want to share. And then I really don't want to be asked many questions outside of that. I
Mm-hmm.
almost feel a little bit unfriendly sometimes in the amount that I'm willing to tolerate in terms of what I share with my family. And I know it's really hard for my family and friends because they love me so much. Now,
Mm-hmm.
of course, my husband knows everything, and he's the one I'm transparent with. But, in terms of, my mom and my kids, I need my normal life.
Yes.
Um, and I
Yeah.
need to just be me. And so where I am transparent is absolutely with the people that I meet through these groups.
Yes.
Um, and that's where I get what
Yeah.
I need from there. I'm able to
Yes.
give the same to others. And so I
Yeah.
try to commit myself to helping others as much as I allow
Yeah.
them to help me. Yeah.
I totally echo that answer. I'm exactly the same. Very little conversation, only when needed, because you're right. That's kind of a separate life. And when you bring the cancer in, I mean, me being diagnosed so many years ago, it's almost like a state of denial with my family. I'm not holding that against them. I mean, it's just been a long period of time. And because of my situation, whatever's going on inside doesn't show outside. So, I always oh, you look fine. You're fine. So I'm sure many of us here feel the same way. I have one other quick question. Did they tell you when they discharged you from the trial which arm you were in?
No, no, I believe they don't, because I technically have not had a reoccurrence. I'm still
Mm-hmm.
in the trial,
Okay.
because you're in a
Technically in the
trial.
trial.
You're in
Yeah.
a trial until you have that reoccurrence, because then obviously it didn't work, right?
Mm-hmm. Mm-hmm.
So technically, it's still working. It's still in my body,
And
and
you're still in the trial then?
so I'm still in the trial. I believe when I'm out of the trial, I do know at some time I will be unblinded. I personally, I
Yeah.
know that I got the vaccine. I know.
Mhm.
Yeah,
Okay.
I don't
Well,
have a doubt.
and I
Yeah,
believe it.
too much
I
has
can't,
happened.
I can't thank you enough for joining and sharing today. I will be in touch probably, in the next week or so, just to have a conversation because what you've provided is so invaluable. I would really like your paper to appear on our website so that it can be shared with other patients and help them as much as you've helped all of us. So
Well,
we'll
thanks
have
for
that
having me
conversation.
today.
No worries. Take care and all the best to you.
Thank you so much, Christine. Bye bye.
Bye. Wow, that was such an impactful and emotional um, presentation. I can't thank Alana enough. We started talking when she was first diagnosed, and what a journey she has had. I'm going to take a little bit of liberty here. I'm going to make a couple of announcements, but I'm going to change it up just a little bit because we have another excellent patient story to share, a conversation between Phil and myself. And I see Phil is here just because it was such a good presentation through Atlanta that I wanted her to be able to finish. So thank you for your patience. I think you won't mind because it was such a good presentation. And we will carry on with the rest of the regular agenda following. But I'd like to introduce, and Phil, I'm sorry, it's a tough act to follow, but I know you will do a great job because you have a unique story as well, and you are a great speaker. So I'd like to welcome Phil Rivard, please. And Phil, we're going to take Alana's name off the middle, and we're going to get Phil to join. Thank you. Well, Phil, I know you're there.
You see me now?
I can see you now. I see your Christmas tree. That's beautiful.
Thank you.
Phil,
Well,
I
afternoon
would
all.
like you to introduce yourself. Okay, I think.
I'll do that. Good
Okay.
afternoon all. My name is Phil Rivard. I'm from Ottawa, Ontario. Wow, what a very informative day we had today from the doctors, the researchers, Alana, yourself. Thank you.
You're welcome.
All this information goes somewhere in Phil's little head. I was diagnosed with kidney cancer in the fall of 2022. In 2023, had 2 surgeries to try to eradicate the cancer. However, it didn't work. So May of 2023, I had a full nephrectomy, lost my ureter, top my bladder. And then that was supposed to be end all and be all. However, it did spread into my bladder afterwards. And so in the dialogue, in the narratives, post-op reports, the acronyms of UCC, RCC, and TCC is spread all over. So basically, I had 3 things at the same time. It was quite the route I took. I was given to. I could say journey. Some people don't like it, but actually, it is a journey. I own this journey. And then first, when I was diagnosed, it was a very dark hole I was in. With the help of KCC and yourself, Mona, and the information I received, and the chat group, I was able to find the root in this dark tunnel called cancer. I didn't ask for it. I got it. I own it. It's mine. It's not who I am, but it's what I live with. And the stats are the stats, so the numbers are there. I can play with the stats and negotiate it. I've lived with it, and I've been to battle this. It's not a battle; it's a lifestyle. I choose to partnership with my oncologist, my doctors, my urologist, my GP, and everybody else involved, along with Kidney Cancer Canada and the chat group, to make sense of this. It's a step. It's kind of like walking the beach down south, right? Or walking the beach in Ontario, or somewhere where there's the beach. It's a step. But when you look back, the waves go in, that step's gone. You're moving forward. I've learned through the chat group, and I've learned through my experiences throughout life, is I got 2 ways to take this event. Have a negative impact in me or a positive impact. And I'd rather go positive. And that's why I'm here today. And that's why I've always been here for Kidney Cancer Canada, because you guys gave me my little life jacket of life. One of the many that I've received throughout life. So, although all diagnoses are not the same and all the results are all the same, they're not the same. We're all on a different journey, different path. You call it whatever you want. The end result is to move forward. We're past the time to blame. I could have done this better, could have done that better. I could have changed my work environment, my social environment, my personal environment. That's not going to change anything. Tomorrow is going to be a different day, and I got to move forward. What I did do, and I regretted doing, was going through that rabbit hole of Dr. Google. I so misread everything I got. And at 3:00 in the morning, one day, my noggin woke me up going, "You so got this wrong." And I went the right way, used the right resources, the Mayo Clinic, Kidney Cancer Canada, Cancer Canada, the National Health System in Britain, some other sites that were prominent, verified research that I was in a lot more complicated seating than I thought I was. So with you guys, with your help, the chat group, and the chat group is amazing. Different people. We're all from different parts of Canada. We're all dealing with cancer. And we all come together in a common bond to share our experiences so other people can learn from their experiences. Kind of like benchmarking.
Mm-hmm.
Where am I at? Where are they at? How did they get there? Did it work for them? I'll try that way because you benchmark yourself forward. And so what I do is keep an app, a journal of all my appointments. Right now I'm at number 90, which is blood work, CT scans, specs, surgeries, procedures, cystoscopies. Those are fun. And then, consults, stuff like that. Things are petering off. There's not much that I can do right now. My last result is I have a non-invasive high-grade cancer cells, which is part of UCC, which is different. And apparently it's a different way of behaving. It's went past RCC. It's spreading a bit. However, it's staying where it is. My treatments are working. My what they're calling again, BCG is working for the for bladder cancer. I took chemo. That didn't work. So I got an immunotherapy type of immunotherapy. It seems to be working. I can't read the forward clock. I don't know what's going to happen down the road. But what I do know is I'm going to own it.
Yeah.
Thank you.
Well, thank you, Phil. That's a really, really interesting situation that you got into. Like you just kind of expected first that you were just dealing with kidney cancer, and then the next blow came, and the next blow came, and you kind of, I hate to use this analogy, but you've rolled with the punches and gotten back up. Not to belittle, the mental and the emotional anguish that you went through as well, as much as the physical. And you talk about cystoscopy, and that's definitely physical. So it's a complete journey, and everybody's, we're using the word journey because it's been used so much today, but everyone's is unique. Everybody's is different, yet we all are in the same boat. So it's wonderful when we can get together. And as you know, you mentioned the coffee chats, how every one of us in the coffee chat is different. Whatever we're dealing with is different, yet we're in the same package. So your sharing today makes all the difference for many of us here. And I see some of your friends from Coffee Chat. And I want to say to Alana too, I hope both you and Alana check the chat, because there's great comments from people that are supporting you and that you may well know. And we wish you all the best in your journey. And I hope to see you, if you can, if you're not walking that beach. Because actually, that's something I would like to bring up, if you don't mind, Phil. That is something I really admire you for, is you are living your life to the fullest by you're traveling, you're not letting this hold you down. Like, you probably coordinate with your doctor, and I know you have a great team, so that you can do things that make your life worth living.
True.
And yeah, go ahead.
And you have to. There was a comment saying
see Lori's comment, yes.
That's my wife telling me to remind me next week.
Way to go, Lori.
In the line of work I used to do years ago, woulda, coulda, shouldas was a common term for a lot of people
Mm-hmm.
whom had to work alongside with as clients.
Mm-hmm. Mm-hmm.
And I didn't want to do the woulda, coulda, shoulda. Uh, I wouldn't be where I'm at today if it wasn't for what I learned in the past.
Mm-hmm.
You know, some people in my family or personally or professionally uh, get into a strife situation and let that strife become them.
Mm-hmm.
After a while, that soapbox gets pretty heavy for a lot of people.
Yeah,
But I'd rather take charge of where I'm at. If this is going to go down a slippery slope, I'm going to enjoy the toboggan ride.
that's a great analogy.
One thing I did learn today, and I was really amazed by the shared openness by the doctors,
Mm-hmm.
by the patients, Alana, and the other
Mm-hmm.
ones, the nurse in West
Mm-hmm.
7. That was my place for 3 days.
Yes.
Uh, and kidney and Cancer Canada.
Yeah.
And you notice my opinion on the partnership with them.
Yes.
I think it's profound. It's about time that we collaborate more efficiently among the other groups.
Yes. I
Cancer.
agree.
I got bladder cancers, but I decided to stay with one group instead of sharing myself with all these groups.
Yeah. I'm glad you
What was it?
did, but
Yeah, I'm glad I did too. And I
yeah.
think we'll be gladder later on once we resolve a couple of things that's on the go.
Yeah.
So I'd like to thank you very much for giving me the opportunity to share. I do
Okay.
wish everyone a fantastic trip in your journey. You own it. Own it. It's part of you. Can't do nothing about it. Thank you.
Thanks, Phil. Take care and have a great trip.
Will do.
Okay. So there's two excellent patient shares that really make a difference, I think, for all of us. I know they do for me, and this is why um, these people mean so much to me and why I do what I do.